Case is shedding light on the mental health struggles that new moms can sometimes face.
And in some instances, medication might actually complicate things. WBZ's Louisa Moller is live in Boston to explain more on this. Louisa?
Well, first, David and Courtney, experts tell me that Lindsay Clancy, she is not a typical case. So we took a deeper dive at maternal mental health care issues overall, what they look like and how they're treated.
No motivation, she has to force herself to get out of bed.
A psychiatrist listed some of Lindsay Clancy's symptoms last week, the kind of emotional testimony that is now shedding light on maternal mental health overall.
If you have a pre-existing mental health condition, the postpartum is like no other time in any human's life.
Dr. Julia Riddle is a psychiatrist and clinical researcher at the UNC Center for Women's Mood Disorders. She says new moms experience an array of mental health issues, from 8 in 10 experiencing the baby blues, a general struggle with changes, to 2 in 10 new moms experiencing postpartum depression, and up to 3 in 10 experiencing postpartum anxiety. But postpartum psychosis, which Clancy's attorney says she was experiencing at the time she killed her 3 children and attempted suicide, is much rarer, roughly 2 in 1,000 new moms.
It's a psychiatric emergency, so it can happen rapidly.
Riddle says experts generally agree they can happen within the first 12 weeks after birth, many times linked to underlying bipolar disorder, and is highly misdiagnosed.
Irritability, agitation, becomes psychotic, thinks something is wrong, until what we'll say mom loses insight, right? She doesn't realize that these thoughts are not real.
The treatment is different than postpartum depression. It can include antipsychotics, even a therapy that runs an electric current through the brain.
Let's say you're prescribed medications for PPD when you actually have psychosis. Is there an adverse impact on the patient?
Yeah, listen, there is. If you have the wrong diagnosis, you have the wrong treatment.
While rare, the symptoms associated with postpartum psychosis are scary. But Dr. Aruj Heder, medical director of MCPAP for Moms, says perinatal and postpartum mental health screening has improved.
I think we really need to provide education on all of perinatal mood and anxiety disorders as a whole, in case they encounter a mother who is potentially struggling.
So you heard from both experts there needs to be more training in perinatal mood disorders. That's from when planning a family to all the way 1 year after giving birth to a child. And they say that should include obstetricians, doulas, and pediatricians. Live in Cambridge, I'm Louisa Moller, WBZ News.
All right, Louisa, thank you. When testimony resumes tomorrow, you can watch the trial live on our streaming service, CBS News Boston, and also on the CBS Boston YouTube page. Courtney?